My presentation, greetings to everyone. My presentation is on pre-menstrual training, menstrual hygiene practices, attitude, and disorders among Nigerian adolescents. By way of introduction, menstruation is a normal physiological process that begins during adolescence and may be associated with various symptoms occurring before or during the menstrual flow. Normal menstruation depends on a highly coordinated interaction between the hypothalamus, the pituitary glands, the ovaries, and the endometrium, with all these events usually occurring in a cycle time frame, often between 21 and 35 days. You have some adolescents having 21-day cycle. It could be 28. Sometimes it's springs to 35 days. The objective of this study is to determine the influence of premenstrual training on menstrual hygiene practices, the various menstrual disorders among the girls, as well as the influence of educational status on menstrual hygiene practices, with a view to making necessary recommendations that will help improve the practices. The methodology. I'm going to talk about the methodology. The methodology is cross-sectional, and it was carried out is a cross-sectional study that was carried out in Lagos, Nigeria. The target population is adolescent girls in the city. The instrument used for collecting of data was the semi-structured questionnaire, and it was administered consecutively to 526 respondents. The demographic and social economic information were also included. The sampling method used is the multi-stage sampling method, in which the Lagos State local government, 1/3 of it in the stage one of the sampling frame of the entire local government was obtained. That is the stage one of the sampling. And out of these local governments, 1/3 of the local government were selected by random sampling. The second method was that in the stage two, the towns in this local government were also selected randomly. And in each of these towns, we have houses that were also selected randomly. The questionnaires were administered to respondents that were willing and have given their consent. Now, the data analysis was done using SPSS version 20.0. All data were expressed at the mean standard deviation. Frequency counts were generated, and the statistical significance was performed with chi-square test. Significance was fixed at less than 0.05, and highly significance was placed at less than 0.01. Now I'm going to present the social demographic data of the respondents. That is on table 1. 26% of them were between 10 years, the 11 years 56, 12 years 54, 70 for 13, 14 years 88. The majority of the adolescents were between 14 and 16 years, as can be seen on the table. Now, the another sexual demographic data that was collected was the type of family these adolescents came from. We looked at the nuclear family and the extended family. 380, that is 72.2, were from nuclear family, and then 21.3% were from the extended family. We also look at their religion. About 60% were Christians, 39.9% were Muslims. Then we look at their level of education. The level of education, we have most of them to be at the senior secondary school level. That is 51.0% are at the senior secondary level, the adolescents. Now, the relationship with their mother, we found out that about 79% of them were very close to their mothers. 16% were just closed, and ordinarily just 1.9%. Now we also look at other variables, that is the current menstrual period, the absorbent material used, and we found out that 21% of them use the water closet, 19 dustbin, that is where they throw the material used to collect the blood. Now we also have the age that the first menstruation occur in the lady. We found out that about 11 years, 12% of them 11 years, 25 and 22% for 12 and 13 years respectively. Then we look at the experience that they had at the first menstruation. Most of them, about 32.3 of them, were frightening at the first appearance of the menstruation. 24% were confused, and 16.7% were expectant. Then we look at the duration of the flow from the study, 5 days duration, and about 36. Now going to the table that is talking about the symptoms, we found that about 15.6% of them had pimples. We had 11% fatigue, dizziness, the mood swing, about 9.1%. This is the chi-square table showing the factors that influence the premenstrual training and menstrual hygiene. The educational status does not necessarily determine the premenstrual training or the menstrual hygiene. So that was accepted. It was an hypothesis which was accepted. Then the relationship with the mother too was accepted. Is one of the hypotheses, but the educational attainment of the mother on premenstrual training was rejected because of the critical value that was higher. Now, educational status has no influence on menstrual practice hygiene. The relationship with mother too has no effect. Educational attainment of mother had no significant effect. The null hypothesis is rejected, and test statistics because of the tabulated of the critical that is greater than the critical value, what was calculated, what was obtained. Now, in conclusion, premenstrual training is common among the adolescent girls, and it's evident in their menstrual hygiene practices. That means they get a training, a form of training from their mother, at least their closeness to their mother. And we found out that dysmenorrhea and menorrhagia are the common problems, that is disorder among the girls. I find out that health education and health promotion are the best way to deal with menstrual hygiene and disorders issues effectively. It is therefore advised that these can be included in school curriculum and implemented by the teachers in order to enhance the teachings at home by these mothers. These mothers give a kind of information to their words before the time of their menstruation. So this study is saying that the school curriculum should also have this in their curriculum. So as the mother is talking, the school is also talking. So we have this adolescent getting good information from the school and also the mothers. Thank you very much. This is the end of my presentation.